Our workshop this evening, we're going to talk about peripheral neuropathy solutions. Lots of times you can gain information when you watch people's videos on YouTube or here on Facebook, wherever it might be. And they'll give you some information. They'll tell you what it's all about, and this is how people get peripheral neuropathy, and this is some drugs that you can take. That's not what this is about. Tonight we're talking about peripheral neuropathy solutions. I'm going to fill this board up with information tonight, information that you can use. I'm going to save this video. It'll be right here on my Facebook page, and you can come back and look at this over and over. As well, we're going to have the opportunity, we allow people to ask questions. When the video is done, I'm going to post it up on my page, and you can just ask questions in the comments section below, and I do my best to keep up with them and answer any questions. As well, I'll put my phone number up there if anybody has questions. But last time we did this, I had somebody call from California, I think it was. It doesn't matter to me where you live. What matters to me is that you get this information. All right, I am a board-certified chiropractor. I practice here in North Carolina, and 23 years ago, when I started practicing, I did the same thing as every other chiropractor in town. We adjusted people, and we helped people that have back pain or neck pain, and that got old really fast. I really got bored with that. But I was always intrigued when we get patients that would come into our office with the usual back pain or neck pain, but they also told me, hey, I've got fibromyalgia, I've got peripheral neuropathy, I got thyroid problems. And I was always like, gee, I wish I knew what I could do to help these people. And it wasn't until I met this fella here, a friend of mine, Dr. Michael L. Johnson. Today's his birthday, actually. Happy birthday, Mike. He wrote this book, What Do You Do When the Medications Don't Work? A non-drug treatment of dizziness, fibromyalgia, migraine headaches, and other chronic conditions. I had a nice young girl come in today dealing with migraine headaches. And she's about 20 years old, and she's been dealing with migraine headaches since she was in grade school. Right? She goes to the doctor, the specialist, once a year, and every time she goes back there, they increase her medications. That's all they do. But she still gets migraine headaches. And to me, this is the height of absurdity. Well, when I started studying with Mike about 10 years ago, I realized that there's other ways that these people can be helped, stuff that I didn't learn in school. So I get up every morning at 5 a.m. and I study this stuff. Once a month, I spend a whole weekend studying online, studying neurology. Every morning I get up and I review this stuff, neurology and metabolic work, and all these things that we're going to talk about here tonight are things that I'm getting up at 5 a.m. to learn. I'm learning the newest cutting edge stuff that your doctor might be doing 10 years from now. I'm learning about it and doing it here in my office. Because that girl that I just told you about, the migraine headaches, she's going to get well. And she's going to get well because I'm going to do the proper evaluation on her. We're going to find out all the things that are creating her migraines, because it's not the same for everybody, yet everybody gets prescription drugs. And we're going to fix those things. And when we fix those things, her life, she's going to get her life back. And tonight we're talking about neuropathy, right? Same thing. If you're dealing with neuropathy, all you're getting from your doctor is prescription drugs. And the things that we get are Lyrica is one of the more common ones now. Lyrica, Neurontin, gabapentin. None of these things, some of them may be helpful in some cases, but none of these things can ever fix neuropathy. If you got neuropathy because you were deficient in Lyrica, then taking Lyrica would cure you, right? But it doesn't. That's the problem. And so when we talk about all these things here, it's going to make a whole lot more sense to you, and you're going to question why you're taking that laundry list. I had a nice woman, a patient, she's probably in her 60s, maybe 70s, probably 70s now. And I asked her, tell me what medications you're taking. She whips out the list. Look, if you're taking a list of medications, you're never going to get well. You are never, ever going to get well. Look, if there's one thing you get out of watching me tonight, you're never going to get well if you take a laundry list of medications. Right? Did you ever see the story of someone who takes 5, 6 medications, 7 medications, and they keep adding it, 8 medications, 9 medications, and then all of a sudden they take that one last medication and all of a sudden they get healthy again? Did you ever hear that story? No, you didn't, because it doesn't happen. You can't take 6, 7, 8, 9, 10 different medications thinking it's going to make you healthy. It won't. It's making you a toxic soup. What you've got to do is fix the underlying problem so that you can get off of medications. I'm not allowed to take people off of medications, and I don't want to be responsible for that. I want to be responsible for fixing the underlying problems so that you can go back to your doctor and have your doctor take you off those medications. And there's not a week that goes by here in the office that we don't see that. Another patient comes in and says, hey, they cut my blood pressure medication in half. Hey, they took me off that cholesterol medication. I cut the blood sugar medication in half. I got a guy who just stopped taking insulin. And his doctor said that's impossible. Once you start taking it, you have to take it for the rest of your life. If he kept taking insulin, he would die. We changed what he's eating. He doesn't need insulin anymore. It's not rocket science, folks. So one of the things that we do here in the office is we create these DVDs so that we can share with people the information about how things work in our office and that there is hope. What do you do when the medications don't work? Well, there is hope. This is the first one we did is the management of chronic neurological and metabolic conditions, breakthrough treatments for chronic health problems. And we talk about how our system, how our philosophy is very different than, certainly very different than any medical doctor you've seen, but it's completely different than any other chiropractor that you've seen. And then this was one of the latest ones that we did, very specific, breakthrough treatments for peripheral neuropathy. And if you're watching this, it's probably because you or someone you know and love has neuropathy. And neuropathy is the burning, the numbness, the tingling, the pain in your hands or in your feet. Some patients we see have both. It's terrible. It's terrible. And we've got to dig and dig and dig and try and figure out what it is that's causing neuropathy in each individual patient, because it's not the same thing in everybody. So what I'm going to do is I'll start up here and I'm going to draw a picture. And we're going to start right in the middle and we'll put PN for peripheral neuropathy. Then I'm going to draw all the things around it that go into why you may have peripheral neuropathy. And each of these contributing factors can in and of themselves cause neuropathy, but more likely it's a little of this and a little of that and a little of this, and that's why you have neuropathy. So you got to figure out exactly what your triggers are, what your problems are. The number one thing that we do when we evaluate someone here in our office is a very targeted, specific, brain-based neurological evaluation. It is the young girl came in, no, it was a different patient. It was yesterday. We had a new patient, and she said, this is the most thorough evaluation I've ever seen. And I'm not telling you this to brag. I'm not, because I didn't invent this evaluation. This is stuff that I've learned from some really smart guys. I surround myself with the smartest guys in the world. And I think just by hanging around them, I got to be getting a little bit smarter. My patients think so. You've got to do a neurological evaluation that targets the brain and then from there works its way down to the peripheral nervous system, because the brain controls your peripheral nerves. And when you are feeling things like burning, numbness, tingling, lots of people will say, I feel like there's, my sock is balled up underneath my foot. I feel like there's bugs crawling up my legs. You saw the event that we created on Facebook with the fire ants crawling up their legs. People say that, and they'll look to see, where's the bugs, and there's nothing there. They'll look to see if their sock is balled up underneath their foot, and then they realize, I'm not even wearing socks. So there's many different places from the feet all the way up to the brain, specifically in your parietal lobe, where there can be a problem with the way your nervous system works. And if there's a problem in any of these different areas, they call it the longitudinal level of the lesion, you've got to look at all of these different things. The brain, the brainstem, the spinal cord, the dorsal roots, the ventral roots, the peripheral nerves. You got to look at all of these things. And when you evaluate all of these things properly, you can determine, hey, this is where the problem lies. That's where we need to focus our efforts. And our efforts are now at retraining that part of your nervous system to function at a higher level than it is right now. So the brain evaluation is critically important. But what's just as important and ties in with that is gut function. And there is a direct connection between the brain and the gut. Many people call it the gut-brain connection. And if there's a problem in your brain, it's going to lead to problems in your gut. If there's a problem in your gut, it's going to lead to problems in your brain. Which came first? It's the chicken or the egg? And in our instance here, without sounding harsh, I don't really care which one came first. It doesn't matter to me. Okay, it would be great if we knew, but many times we can't figure it out. What's important is we find the problems here and we work on those, while at the same time we find any problems here and we work on those. And as I'm fixing this, it helps me to fix your brain. When I'm working on your brain, it helps me to fix your gut. So the double-edged sword that creates what you think is two different problems is also a silver lining, because as I'm working here, it's helping me fix here, and as we can fix this, it helps us fix your peripheral nerves. So the gut evaluation is critically important. What's important with the gut is that's where 80% of your body's immune system lives. And the immune system is critically important. And one of the things that we see rapidly growing in this country is autoimmune diseases. And one of the things is the immune system can attack your peripheral nerves. And this is very common. Nobody's looking for this stuff, except in our office and the network of doctors that I work with. But if this is the problem, how can Lyrica fix that? It can't. It can't fix that. All right? So we've got to evaluate the gut. And when we talk about the gut, that means your stomach, your small intestine, your large intestine, and your gallbladder. That's what I'm talking about. With the stomach, one of the things that we see, this is one of the organs in your body that's most likely to have a pill. And one of the most common prescriptions that we see is the proton pump inhibitors or the H2 agonists, the reflux, indigestion, heartburn type pills. The issue is not that there's too much acid. That's what the drug manufacturers want you to think. The issue is that there's not enough acid. And I could go on for about an hour on this topic alone. But by the age of 30, you start producing less and less acid in your stomach every year. It decreases. You're making less and less every year. So how can half of this country, half of the adult population in this country, have too much acid in their stomach? It doesn't make sense. So you take these pills, and it further lowers your acid. It makes you feel a little bit better while you take it, puts out the fire, but it's actually making the problem worse. One of the things that you need to be evaluated for is H. pylori infections. If you don't know what it is, you need to message me down at the bottom here, put it in the comments section, or again, call my office. Small intestine. This is where a lot of your good organisms, the good bacteria lie, your part of your immune system, the probiotics, prebiotics, all these guys, small intestine. But every time you've taken an antibiotic, and which starts when you're this big and you got little earaches and runny noses, and every time you go to the doctor you get another antibiotic. I don't know what the latest average is, but by the age of 2, kids have taken 6-7 rounds of antibiotics. That's devastating. That's devastating to a little tiny developing gut where you're supposed to be, first of all, you're supposed to be getting breast milk, and most kids aren't getting that. But this little tiny developing gut keeps having antibiotics put in that's blowing up your rapidly developing gut flora, the good bacteria. You're supposed to follow up with months of a probiotic, the good bacteria, after you take antibiotics. But doctors, bless their heart, I don't know if they know this stuff, if they know it, they just don't have the time to tell you, they don't really understand it, they're not sure, I don't know what it is. They're not bad people, but they're just not getting the word out. Every time you take an antibiotic, you gotta follow it up with months of a probiotic, and if you're not, you're winding up with small intestine problems. This is where you develop a problem called leaky gut syndrome. And again, if you've heard of many people have heard of leaky gut, but they're not really sure what it is. Again, fire away, ask me questions. Large intestine, next one. Large intestine is where you collect all of the waste that your body needs to get rid of. And you're supposed to be getting rid of that waste at least once a day, preferably twice a day. And as long as you're going once or twice a day, your large intestine's functioning properly. And I have had people in here to tell me, I go regularly, once every 3 days. That's not regularly. That might be what you think is normal, but it's not normal by any stretch of the imagination. Because as this waste sits inside of your intestines, the toxins get reabsorbed. So your large intestine is pretty good about reabsorbing things, like you're supposed to suck out water. That's how your body can kind of conserve water. It sucks water out from the waste. But it can also suck out water-soluble toxins. That's not a good thing. So you want to make sure that this is moving properly. And again, one of the ways that we get people's guts moving, get your bowels moving again, stimulate the brain. Stimulate the brain, large intestine starts moving itself. We've got some really cool techniques here, non-invasive, very gentle techniques that we can get people's bowels moving without taking medicines. You know, if you got to take a medicine, these people take a medicine every day to get their bowels moving. That's not fixing you, right? If you have to take it every day, that's not fixing you. What we're about here is trying to fix problems. Your gallbladder. Many people know that your gallbladder helps you to digest fats. It produces bile, squirts the bile out into your digestive tract at least, and it helps you to digest fats. But many times people have their gallbladder ripped out because you got gallstones. Rather than saying, why did you get gallstones? They just say, oh, there's stones in there, we got to get rid of it. And, you know, many people are bent over in acute pain. They're like, whatever, just take it out, I'm dying. And they have their gallbladder taken out, and they don't really feel a whole lot better. It didn't fix the problem. You got to fix the problem. Why did your gallbladder get in bad shape in the first place? Usually dietarily related. We could spend, again, hours on that alone. But the gallbladder also helps you. Well, let me step back. If your gallbladder is taken out, many times the doctor will tell you, well, you just need to eat a low-fat diet for the rest of your life. Well, I am here to tell you that a low-fat diet is death. You cannot eat a low-fat diet. You must eat massive quantities of fat. Good fat, but you must eat massive quantities of fat. And if you're not sure what the good fats are, message me. All right, so you gotta have fats. Fats are necessary to make what's called myelin, and myelin covers your peripheral nerves. It protects them, it insulates them. And if you don't have enough fat in your diet, you can't make myelin, it makes it easy for the immune system to attack your peripheral nerves. It's bad, bad news. Many folks are taking, many folks over the age of 50 or so are taking what's called statin drugs. And statin drugs are aimed at lowering your cholesterol. But again, you need cholesterol to make myelin. So if you're taking these drugs and it lowers your cholesterol too much, that can create peripheral neuropathy. Statin drugs can create peripheral neuropathy. Right? So again, I can't take you off your statin drugs. But if we can find a way to change your diet so you don't need statin drugs, you can go back to your doctor and ask to get off of your statin drugs. Many times, that's a huge piece of the puzzle. Do not take yourself off of medications, right? Don't do that. Fix problems. Then you can get off of the medications with your medical doctor's help. All right, circle back. We talked about antibiotics. One of the big, bad, ugly antibiotics is a class that's called the fluoroquinolones. And these are nasty. Cipro and Levaquin, and you know, these are just some of the best-selling drugs we have in this country. Very commonly prescribed. But these things are a disaster. An absolute disaster. If you don't believe me, you can go search on Facebook after you're done watching this for the fluoroquinolone survivors. Fluoroquinolone, my life was destroyed by fluoroquinolone. Just search it, right? There's multiple groups out there with thousands and thousands of people whose lives have been devastated after taking a round or two of fluoroquinolones. These drugs have a warning on them stating, you know, these are disasters, they're dangerous, you need to be careful, yet they're still like in the top 10 prescribed drugs. It's befuddling to me. And of course, you know, the average person, these people who are in these Facebook groups whose lives have been destroyed, they never even heard of fluoroquinolones before they went into their doctor. They never heard of that. They just trusted their doctor. They had some type of infection going on. Their doctor wrote a prescription and they took it. They did what they were told. And the doctor probably, you know, the doctor didn't mean to harm, not probably, the doctor did not mean to harm you. But the doctor probably just wasn't up on the fact that fluoroquinolones are horribly dangerous. They can cause all kinds of immune system dysfunctions. They cause tendons to just rupture like that. They cause peripheral neuropathy. You know, I have probably half a dozen patients who've taken multiple rounds of fluoroquinolones, and I just tell them, look, it's going to take a lot longer to fix your neuropathy because those drugs have done some serious damage. It's not hopeless. It's just, it makes it more challenging, okay? So you got to be careful. You have to be responsible for what you're putting in your body. Some of the things that can create your gut going wonky in the first place would be foods. And there are many different foods that people have a sensitivity to. Not an allergy, a sensitivity. So like you eat it and you don't even know it's doing anything, but it's creating a leaky gut. It's throwing gasoline on the fire in your immune system, and it can affect your brain, and it can affect your peripheral nerves, and it can affect your gut. It's just really horrible stuff. And you don't even know you have this problem. So if you haven't been checked properly for food sensitivities, you need to get that done. Now there's a blood test that you need to run. Then there's a specific type of food sensitivity test that you need to run. You got to do things in proper order. If you just go to your general family physician and ask for that, first of all, they're going to laugh at you and say, oh, you're some kind of kook. You don't know what you're talking about. You don't need to have that done. If they are well-intentioned and well-meaning and you can wear them down and they run the test, they ran the wrong test. I promise you, okay? I live here in a town where we've got a major university and a huge hospital system, and this is kind of like the hub of Eastern North Carolina for healthcare. There might be 2 or 3 medical doctors who are running the proper tests. I mean, we've got hundreds and hundreds and hundreds and hundreds of doctors. They're not running the right test. So if you don't ask the right question, you're not going to get the right answer. You got to get the proper food sensitivity testing done. Message me if you want to know more about that. So you continue to eat the foods, and again, you don't know that it's creating a problem. It doesn't cause tummy aches. It doesn't create an allergy type symptom. Like I have allergies to nuts. If I ate a nut, you would know within minutes that I've got an allergy. My throat would constrict, I'd start wheezing, I'd get puffy, it would be horrible. You could tell. But a food sensitivity, you can't tell. It's just slowly wearing you down from the inside, just slowly, insidiously tearing you apart. Creates this leaky gut. So if you got the foods and you got a leaky gut, it creates an immune system problem. And this is just a self-perpetuating cycle. 2 other things that need to be evaluated for was the dysbiosis. And we talked about this already. Dysbiosis just means that you have too many bad bugs living inside your gut and not enough of the good guys. And it's very frequent in people that have taken multiple rounds of antibiotics, whether it's fluoroquinolones or just your general everyday run-of-the-mill antibiotics. It tears up your small intestine, large intestine. Large intestine bacteria start to get up in your small intestine bacteria in your large intestine. You don't have any of the normal bacteria. You got too many of the bad bacteria. It's a mess. It's fixable. It just takes a long time to get there. Many people who are dealing with this triad right here, oh, and I'm going to put parasites in there too, because a parasite infection could be devastating. You got a parasite inside your gut, it is never going away. It's not going to go away on its own. Okay? You have to get it properly diagnosed, and again, just like I said with the food sensitivity testing, most medical traditional healthcare providers are not running the right test. So if they don't run the right test, they say, you don't worry, you don't have a parasite, you kook, you didn't even need that test in the first place. I told you. Right? You got to get the proper testing done. So if you've got food sensitivity, leaky gut, your immune system's going wonky, you got dysbiosis and a parasite infection, and you start having these digestive issues, depending upon who you go to see, they're going to say, well, you have Crohn's disease. Well, Crohn's disease is an autoimmune disease. You have irritable bowel syndrome. You have irritable bowel disease. You have, some people are even starting to acknowledge leaky gut syndrome. You got chronic constipation, chronic diarrhea, right? All of those are just explaining what you have. None of those are telling you why you have. And that's what we do in our office. We figure out why you have this. If you've got an immune system issue, we need to make sure your acid content in your stomach is perfect. We need to make sure that we fix the dysbiosis. Put good bacteria in your body, feed those good bacteria, and kill the bad bacteria. We need to make sure your bowels are moving on a daily basis. If you still have your gallbladder, we need to make sure it's functioning properly so you can keep it. If you don't have a gallbladder, simple supplement that you can take, for the rest of your life, that's going to help. So you can eat proper fats, the good fats. You need to find out which foods are messing you up and get rid of them. You need to take some supplements to heal the leaky gut, and that can take a couple of months to do. Dysbiosis we mentioned, and the parasite. You got a parasite, you take something to kill it. So if we can fix the gut, that goes a long way towards fixing folks who are dealing with neuropathy. If we fix the gut, it also helps us to fix the brain, which goes a long way towards helping people with peripheral neuropathy. Does that make sense? I mean, this is simple. It's very, very simple, but you got to get all this stuff done. Some things that we need to do to quiet down the immune system. Right? Your immune system is like a little teeter-totter, and it can get stuck in this direction or in this direction. It's pretty complex, but for simplicity's sake, we can say it's TH1 or TH2, and you want it balanced. This is what you want your immune system looking like. And if you get stuck in one direction or the other, that can be a disaster. That can be a lifelong problem as far as autoimmune disease is concerned. Some things that will help us to balance out your immune system is vitamin D. You need to make sure that your vitamin D level is optimal, not within normal limits. Normal limits are considered 30 to 100. If you're at 31, the lab says you're fine. You're not fine. For optimal health, I want to see that number up around 60, 70, 80, way up at the normal range. But there's two different types of vitamin D. You need to get both types checked. And if you don't get both types checked, you're playing Russian roulette. See, vitamin D, it's a misnomer. It's not a vitamin, it's a hormone. And you can't go playing willy-nilly with hormones. You need to know what you're doing. Or better yet, you need to go to someone who knows what they're doing. So when I see someone come in and they bring some blood work from their medical doctor, and they say, my doctor checked my vitamin D and they said it's absolutely normal. First I say they only checked one vitamin D, not both. So I say, okay, that doctor doesn't understand what he's doing. And then secondly, their vitamin D level is at 30.5. And their doctor says that's normal. And I say, okay, that's not normal. It's not even close to normal. Don't worry, you're here. We're going to fix you. Okay? That's vitamin D. Next, essential fatty acids. Everybody's heard of these fish oils, omega-3s, krill oil. There's many different forms. What we've got to do is make sure that you're getting plenty of essential fatty acids in your diet. And again, these are ones that create an anti-inflammatory environment. We're going to make some dietary changes with you. Right? And some people don't want to hear that, but that's the facts. You can't keep putting food in your mouth that makes fire and then try and take a pill to put out the fire. And that's what we do. As an American society, that's what we do. We are trying to do whatever we want to do and then look for the magic pill. Well, that's when people come in here taking 20 different pills. How's that working out for you? It's not. Last piece of the puzzle is glutathione. It's abbreviated GSH. It has sulfur in it. Glutathione is the world's most powerful antioxidant. And your body, specifically your liver, produces large amounts of glutathione when you are healthy. And when your health has gone downhill, your liver doesn't spend so much time making glutathione. Your liver and the rest of your body is just trying to get you through the day. I mean, you know exactly what I'm talking about. Just trying to get through the day, right? You feel it. I'm like, oh, it's only 2. If you have to look at your watch when you're at work, oh, it's only 2 hours to go. That's not life. You're not living. You're surviving, barely surviving. If that's your life, man, I can't even imagine. You got to start getting this stuff checked out. You have to. Next is blood sugar. And when we talk about blood sugar, most people will say the first word that pops into their mind is diabetes. And yes, diabetes is rapidly growing, one of the fastest growing disease processes we have in this country because we're doing it to ourselves. We're eating ourselves into this. I had a discussion with a patient today. Well, I don't eat a whole lot of sugar, I eat breads and pasta, but they're, it's whole wheat, and I eat oatmeal every day. People just don't understand. That's all carbohydrates. And when you eat a carbohydrate, what does it turn into inside your body? Okay? So, diabetes is bad. So bad that there's a separate subsection of people with neuropathy that's caused by diabetes. They simply call it diabetic neuropathy. But I'm telling you, there are, tens of millions of people who are not diabetic yet, who've been told, you're pre-diabetic, we're just going to keep an eye on you. We're just going to watch you. That makes me crazy. What that means basically is, I'm not going to do a dang thing for you. I'm just going to wait until your blood temperature, your blood sugar gets up to 126, then I'm going to hit you with my pills. But right now, you just keep eating your Mac Whoppers and driving through the donut line and, whatever. Don't get me started. Drinking your iced teas. Blood sugar is an absolute 100% deal breaker here in our office. Again, I'm very strict. I want people's blood sugar to be 85, in between 85 and 99 all day, every day. So it looks like this. That's what your blood sugar should look like throughout the day. When the blood sugar goes too high, that's insulin resistance. When the blood sugar goes too low, that's hypoglycemia. And many people who are dealing with chronic health problems, specifically people dealing with peripheral neuropathy, have blood sugar that looks like this throughout the day. And if that's what your blood sugar looks like, I can't fix you, and there is nobody on the face of the earth that can fix you. You've got to fix the blood sugar. The good news is, we don't fix people's blood sugar by giving them pills. We have you fix your own blood sugar by changing what you put in your mouth. And we go over this in great detail. And it's not the same exact thing for everybody. Every person has their own individual needs. Some people that we see with peripheral neuropathy don't even have any blood sugar issues. But I'm telling you, even if you have a slight blood sugar issue, it needs to be fixed. It is absolutely mandatory. If you are pre-diabetic, what that means is you are about to get diabetes because you're not doing a thing about it. Just this little subsection. If you are dealing with pre-diabetes, call me, please, because we can fix that. All right, I'll tell you exactly how to fix it. So we've got to fix this here. When the blood sugar gets too high, that's insulin resistance. What that means is the sugar, for simplicity's sake, sugar can't get into the cells. Specifically, glucose can't get into your brain. And your brain needs glucose to function properly. When your blood sugar goes too low, that's hypoglycemia, and it basically means there's not enough glucose in your blood, so your brain can't get any. So either way, hyper, hypo, your brain's not happy. So your brain screams down to your stress glands, the adrenals. And the adrenals produce a hormone called cortisol. And cortisol will work well to balance your blood sugar. But cortisol is only supposed to be secreted into your circulatory system under times of extreme stress, not 4 or 5 times a day, every day. That's a disaster. And it's got a number of really, really bad effects. First, cortisol, when it keeps getting dumped into your circulatory system, starts to impact an area in your brain that deals with memory, focus, and concentration. Early onset dementia. Alzheimer's. Alzheimer's has been described by many people now as type 3 diabetes because they're saying the blood sugar is the #1 factor in creating these cortisol surges, which starts to eat away at the hippocampus. And that's not a good situation because what they'll do is nobody will address this. They'll just give you some pill that they think is going to help with your memory. That's not the way it works. If there's a leak in your boat, you're going to pick up a Dixie cup and start bailing? That's what we're doing when we give pills to people with Alzheimer's, and we're not addressing that. How about you plug the leak in the boat? Right? That's what we need to do. Fix the cause of the problem. Many, many times, it's blood sugar related. So the cortisol affects your memory, focus, and concentration. Cortisol also has an effect on folks and we see it, you know, somewhere around the third, fourth decade of life, you start to gain weight for no reason. You know, I'm not eating anything different, but all of a sudden I'm starting to gain weight. It's right around here, you know, all in the midsection. That's cortisol. And the last piece of the puzzle here is when cortisol gets secreted, it also brings along epinephrine and norepinephrine. And these are neurotransmitters that irritate your free nerve endings. And when your free nerve endings get irritated, what that means is pain. So whatever's hurting hurts more. Again, all of this feeds back to the blood sugar. So if we don't balance the blood sugar, you're never going to fix this. All right? Last piece of the puzzle. Oh, actually, no. When the adrenals have been stressed out for a long enough period of time, you develop a new problem. Sleep issues. I can't fall asleep. I can't stay asleep. Some people have both. I can't even imagine. Like I said, I get up at 5 every morning, so I'm typically, you know, asleep at 11. I crash at 11, up at 5. That's perfect for me. That works well, okay? But if you go to bed at 11 and you're still tossing and turning at 1, and then you finally fall asleep and you wake up at 3, I couldn't do what I do every day. I don't know how people can function like that. However, there's lots of people who are like that. This is why in the overwhelming majority of cases. So you got to fix this first, and then you got to nourish your adrenal glands. And sleep comes back to most people that way. You don't have to take pills. You don't have to take those prescription hallucinogenic drugs to make you sleep. That's not sleep. That's drugging you. You're not getting into deep REM sleep where your brain is, you know, flushing toxins and improving its function. You're not getting there when you take those pills. Fix the underlying problem. You don't need those pills. Last piece of the puzzle is thyroid function. And your thyroid is a little butterfly-shaped gland up here in your neck, and it produces hormones that give you a get up and go. And many times in people who are dealing with neuropathy, we see things, you know, this is a typical pattern. I got brain fog, my digestion's not good, certain foods really bother me, I got that indigestion, I got diarrhea or constipation, both really bad. Blood sugar's gone wonky, I don't sleep well, I got pain, I'm too fat in my stomach, my memory is not as sharp as it was, and I don't have the energy that I used to have. Does that sound like you? You know, it sounds like half of this country at least. And the other half of the country, you know, has just half of those problems. So if you have a thyroid issue, the number one reason is because it's an autoimmune condition. The immune system attacking your thyroid. And there's a simple blood test to look for. And if your immune system is attacking your thyroid, you don't need thyroid hormone. You need to fix your immune system. Like these things. Change the food, heal the leaky gut, fix the dysbiosis, the parasite. You know, fix these things, and then the immune system will stop attacking your thyroid. Food sensitivities are a huge piece of that puzzle. But if you don't have enough thyroid hormone, you know, every cell in your body needs thyroid hormone to function properly. If you don't have enough thyroid hormone, nerves, specifically farthest away from your thyroid gland, they're not going to work well. They're going to suffer. They're not going to get what they need. And if they're not getting what they need, they're not getting the proper nutrition, oxygen, activation, glucose. If they're not getting these things, then you're going to develop peripheral neuropathy. But everybody that comes into my office has a different problem. Some people it's a brain problem. Some people it's a gut problem. Some people have both. Some people have multiple food sensitivities and a parasite infection. Some people have no gallbladder and they have a bowel movement once a week. Other people have blood sugar problems and adrenal gland problems. So everyone that has neuropathy has it for different reasons, yet everyone that goes to the doctor gets the same type prescription. You get Lyrica, gabapentin, or Neurontin. And what scares me most, and if you go on to, I think I've got it here somewhere on my Facebook page, if not, it's at my YouTube channel, Dr. Robert McCarthy, go to YouTube. It's just titled Lyrica. And we talk in that video about how Lyrica, in 2009, it was shown that Lyrica prevents your brain from making new connections. All right, so it's aimed at trying to fix the nerves in your feet while it's making the nerves in your brain not work so well. That just doesn't make sense to me. So, hey, we'll cover that up while we're destroying this. You know, I don't know. And I don't get into conspiracy theories. I'm just into facts, and these are the facts. So if you are dealing with neuropathy and you're taking the pills and you're not getting any better, you've got to get proper evaluation done. And if you don't know where to go or what to do or who to see, you need to call me. I'll give you my phone number now, and I'll put it underneath later. The number here at the office in Greenville is 252-758-2222. Right? Call, no matter where you live, call here, leave a message, I'll get back to you. Or again, if you like, just put some information underneath. If you're, you're shy and you don't want to share your health information with the world on Facebook, I don't blame you. That's fine. Call the office, 252-758-2222. I hope you find this information valuable. If you do, like it down below, share it with your friends. I'm all about that. I got no problem. I want to get this message out to the world. Hopefully you can help me. If there's anything I can do to help you get your life back, whether it's with neuropathy or any kind of other health challenge, that's what I'm here for. All right, contact me, and I look forward to talking to you. Thank you.